Hello, my name is Holden Newkirk, and today I'm going to be presenting to you on why you should become a healthcare worker. According to a February 2020 article by the University of Southern California, there was a 2016 study done by the Human Resources for Health that indicated a global demand for 80 million healthcare workers by the year of 2030. But we're projected to only have 65 million healthcare workers by 2030, leaving a shortage of over 15 million healthcare workers. They also stated that there is a basic need for 23 healthcare workers per 10,000 people, and 83 countries failed to meet that standard. Today, I want to talk about how, with this current pandemic, there's a shortage of healthcare workers as the population grows more old. There's also a shortage of healthcare workers, and how there's also many benefits to becoming a healthcare worker and some of the career paths that you could choose if you do choose to become a healthcare worker. To start, the need for healthcare workers and the equipment we need to help patients is increasing. We've seen this during this whole pandemic. Everyone's saying, we need more healthcare workers, we need more ventilators, we need more face masks, we need more gloves. According to the World Health Organization, actually, there have been shortages leaving healthcare workers ill-equipped for the COVID-19 outbreak. And this has actually left healthcare workers moving from areas like Peoria to Chicago in order to help out. And according to the New England Journal of Medicine, we do not have enough vents for this whole outbreak. Another reason why the need for healthcare workers is increasing, besides the fact that we're currently in a pandemic, is that life expectancy has increased due to benefits in the advancements of medicine. This leaves our largest population group, the baby boomers, who are now 65 years and older in some cases, around in larger population standards. So, according to the University of Southern California, the population of Americans 65 and up is expected to increase by 55% into the year 2030. Showing just how ill-equipped we are as a healthcare system to care for all these patients. So now that I've discussed the need for healthcare workers, I would like to discuss some of the benefits of becoming a healthcare worker. To start, you are needed. There's a drastic need for healthcare workers, and you could be one of those people who helps your community, your friends, your family members, and plays an active role in the community around you. Also, the working conditions in hospitals are superb, and the benefits to being a healthcare worker are off the charts. Health insurance, dental, you can make many friends. There's also a rapid work environment that's very stimulating, and there are many career paths and options that you can take, and many hospitals will actually help cover your tuition as you advance your education. So now that I've discussed some of the benefits of working in healthcare, I'd like to discuss some of the career paths. Some of the common staff that you see in the hospital is nurses who do basic care on patients, CNAs who help out with nurses, respiratory therapists who run ventilators, give breathing treatments, and work with the lungs and heart, and then your doctors. But there's also many other career paths within the hospital that you can choose. You could be an x-ray technician, giving x-rays to patients at bedside. You could do CTs. You could become a speech pathologist and help with people who need rehabilitation of speaking. You could be a phlebotomist and draw blood. You could be a lab technician who does tests to see if people have infections. You could also do research, medical research, or physical therapy. In conclusion, there is a dire need for more healthcare workers. Also, you could help those in your community. There are many diverse career paths and steady employment. So I encourage you to think about, could you be right for the healthcare fields?